Hi, I'm Dr. Eric Westman, and this is the Keto Made Simple podcast.
Hi, everyone. Dr. Eric Westman here. And if you know my channel, I usually review and debunk nutritional misinformation out there. But often I take the chance to interview people who I think are the movers and shakers in the diet, nutrition, fitness world. And it's my great pleasure to have Dr. Kiltz with me.
Dr. Westman, thank you so much for this interview today, and it's always a pleasure to be with you and hear what you have to share.
So did I pronounce your name right? So
Kiltz, yeah, Scottish Kiltz. That's correct.
Like the Scottish Kiltz, got it?
Yeah.
So I've been teaching about low-carb and keto diets for a while, and at Adapt Your Life Academy, we've been teaching people online who can't make it to my office. And we have a group of those people, we call them the Adapt Your Life Academy alumni, who are maybe kind of like your tribe. They're the people who want to stay on in a group, and they get first access to videos like this. And I wonder if you could just introduce yourself to the people who don't know all about you yet.
Well, thank you again for this invitation, and hello to all. And my name is Dr. Rob Kiltz, and I'm a fertility doctor, and I help those that are suffering from either not getting pregnant or miscarriages or other reproductive problems, including endometriosis and fibroids and polycystic ovarian syndrome. I've been doing it for about 40 years now. I'm just about to turn 70. I own and run CNY fertility centers. And I began to integrate alternative medical ideas, acupuncture, massage, meditation, and prayer 25 years ago or so. And then nutrition started with paleo and then keto and carnivore about 20 years ago. And I talked tremendously about nutrition, mindset, helping us heal first naturally before anyone needs the standard medical treatments for fertility. And I've been blogging for a while now, and I tremendously enjoy being part of this community.
Awesome. So take me back to training. You were, and then explain what it takes to be, I think you may have gotten advanced training beyond just OBGYN if it was in reproductive health too. But I saw in there that you'd come through Southern California and
yeah. I always say I'm the kid from LA, kicked out of school in a gang, couldn't read, father in jail. And I get to some of those things, which I think are nutritionally the reason why I was sick and had those problems. But I went to graduate high school in 1974 in Los Angeles. I went on to Los Angeles City College. I happened to go there for 4 years. I was an art major initially, and then I switched over to science and medicine after 2 years. And then I transferred over to the University of Southern California in biology and nutritional biochemistry, and I graduated in 1980. I went on to UC Davis Medical School thinking I was going to go into primary care, 1981 through 85. I just had my 40-year medical school reunion. That was amazing. Yeah, it was amazing. And after I graduated, I actually did a year internal medicine, and then I went into OBGYN, and I finished my my residency in Colorado in 1990. I actually went off and practiced for a year in Sacramento area to Kaiser, and I worked with Dr. Klooster, who did a lot of fertility, and I was invited to do a fellowship in Los Angeles, where I finished in 1993, and I went on to practice IVF fertility medicine for a couple of years, and then I started my own practice, and I did general OBGYN, so I'm an obstetrician gynecologist, board certified in OBGYN. And then I did a fellowship, and I'm board certified in reproductive endocrinology and infertility. So technically OBGYN boarded and reproductive endocrinology and infertility board certified. And I've been practicing let's see, technically since 1993 for my fellowship, and I'm immersed in both the primary practice of infertility, IVF, but I do a lot of natural treatments, as I mentioned earlier, with acupuncture, massage, nutrition, and things like that.
So you created a clinic kind of outside the traditional, well, you might be insurance pay, but outside of an HMO or some other setting.
Yeah, so I started my own practice back in 1997. I did everything OBGYN and fertility. And I was noticing that a lot of my patients would drop out because of the stress and struggles of the process. I didn't have any real understanding why people were infertile or sick. And I began to integrate acupuncture and massage and yoga and meditation and prayer to attempt to reduce cortisol, epinephrine, and stress levels.
I see.
And so the infertility journey is hard. Many people drop out. It's very emotional. It's akin to a diagnosis of cancer. You think you're going to die. And so that's a very stress-provoking diagnosis. And as I mentioned, I didn't really think about diet at all. And I started a business called or a clinic called CNY Healing Arts. So in each of my clinics, we would focus on adding these other modalities. I even built a little coffee house and tea house and a yoga studio where we practiced all these things along with standard IVF and intrauterine insemination and surgeries and things like that.
So you were getting an idea that food or drink or relaxing tea, or there might be something to the nutritional state. I came to this through Dr. Atkins and Dr. Fox, who was a reproductive guy in Tampa, and
Yep.
and then I'm an internist. And when I said at a meeting, one of my patients came to me and said, I got her pregnant, and I joked, it's not what you think. It's I put them on the keto or low carb or Atkins at the time diet, and she got pregnant after not having success with IVF. So I don't treat a whole lot of people for that, but when people started coming to me with PCOS and other, like even going to Duke Infertility, I have the great access to all the allopathic medical care in our area here at Duke. And they would have failures through IVF and spend all this money. And then the doctor would say, well, you might as well just go see the weight loss guy, Westman. Well, little did they know I was putting him on a low carb diet, which clearly has its own therapeutic effects. But our study that we published years ago, it was a proof of concept study that a low carb diet could reverse PCOS and infertility. So this was for me, the late 90s when Dr. Atkins was having some sort of resurgence. But clearly, so stress made a big deal in helping your patients. When did the diet, or maybe you're not using that in the clinic? I guess I was assuming that, but
No. So it was interesting because I was doing Atkins diet in the 90s, the late 90s, for health and wellness purposes, and mostly for I wasn't really weight conscious, but body form conscious, and so I used the Atkins diet for that. And really, it was some of my patients were getting pregnant on the paleo diet.
Yeah.
And that's when I'm like, okay, well, you're getting pregnant on a diet, and I never really talked about diet, nutrition. So I began to and this was back in about 2002 or about 2001 when I started digging into this idea, because that's when I started the Healing Arts Center. Again, I'd known about Atkins and been working in that area and never really sort of plugged these things together enough. And once I started digging into paleo diet and I started reading and writing, and back in the early 2000s, I was doing blogging. I had a website called Mind Body Smile in order to bring the mindset ideas to all of this first. And then as I found paleo diet and started integrating that, and then I found keto diet. And now this is over years, and I found carnivore about 15 years ago, and that's where I was, but I never really talked about it. I was just keto, paleo, and I found you through Atkins' work, by the way, and I knew of Dr. Fox and others doing this for a long time. And it's interesting in my business, the fertility world, it's so much IVF, and everyone wants to jump right into IVF, where the OBGYNs are often treating endometriosis and polycystic ovarian syndrome. By the time they get to me, they've already gone through so much. But it's interesting, so much of my focus really is I go through all your medical problems, and then I want to know what your height and weight is, and then what do you eat? And the usual answer is I eat healthy, I eat clean, I eat organic, which I don't even know what that is. But
Well,
now,
so before we get there, I just want to share that was my story, where I'm an internal medicine doctor at the VA, and two of my patients lose over 50 pounds each, which was an oddity. I mean, it never happened. So lightning twice in front of me, and I thought, I can't ignore this. So it was through my patients that I learned about this. It was through your patients. In my area, it was called Atkins. Well, that's the book they read, but they could have read paleo, they could have read keto, they could have read Banting back in the 1800s. So, well, that's really neat. So, well, then I wondered, did you start using paleo for your patients then? If you did.
well, I mostly started sharing paleo diet and talking about Atkins again, and really sharing these things. And I began to write about it so I can hand them something, because it's interesting, the conversation and getting people to invest in their time and energy to do something was really difficult. And diet is still one of those things where people are like, changing my diet, but my friend, she eats the same diet, and she might be even as heavy or heavier than me if that was the case, and they're getting pregnant. So I've spent so much time digging into what you're doing and others to try to sort of come up and really understand the why part of it, which is something I think I love as much as anything else.
Well, the physiology so why, so to the non-OBGYN or to the lay person, how can a diet like this and stress reduction in your clinic, how can that help with infertility?
Well, the cause of infertility is mostly what we call idiopathic or unknown cause, unexplained. And that might be the same in so many other diseases that we've learned to treat. We don't know why. And so the idea that metabolic syndrome or prediabetes and diabetes is linked to disease, and my sister had diabetes since age 4, and she died of heart failure at 52. And we're seeing so many men and women with diabetes and prediabetes and metabolic syndrome, really trying to come up with the idea that there's some link here, but we can't always exactly figure it out. Now, polycystic ovarian syndrome, or PCOS, irregular menstrual cycles, they're not ovulating, and quite commonly they tend to have higher hemoglobin A1Cs, higher fasting insulin and glucose levels. And so, this dietary approach kind of made sense. And as reading your work and Atkins' work and really seeing that, but then beginning to see it in our own hands as we begin to implement this. Now, inflammation ultimately is the leading sort of underlying or overlying part to this puzzle. And sugar seems to be a leading problem. Now, the question is, where does sugar and where do plants in general come in? And so that was always been a hard one to dig through and figure out. And again, why one person gets these problems and other people don't. But as we begin to talk about Atkins and paleo, and even adding things like metformin for our PCO patients, which seem to help the pre-diabetic and type 2 diabetics out, kind of links all these things together, but answer why one person over or another. And it's kind of interesting as we begin to say, hey, cut out bread and pasta and potatoes, and focus on an Atkins-like diet, which is meat and some green veggies and things like that, low carb plants, we tended to see some improvement in our patients. And at the same time, in your business and in our business, we see the type 2 diabetics getting better, and sort of it goes away. They're dropping weight and they're getting better. And the challenge always says is, why are you sick and you're not? I can't tell you that, but I can tell you that these diets like Atkins and paleo and keto and carnivore and fasting tend to help significantly. And I think I call PCOS plant-caused ovarian sickness.
Oh, I've never heard that before.
And PMS, plant manifested sickness. And and reason is because in general, a high plant, low animal fat diet seems to be part of the culprit, I believe. But it's always a hard one to know, again, which one is which.
Now, I've had some patients tell me that their premenstrual symptoms improved or even went away. But I've never seen a paper on that, or even a book. I think that'd be a great book. No more cramps, no more menstrual cramps.
Well, I'm convinced that endometriosis and endometritis are all related to the same damaging diet we've all been consuming.
Well, when you say idiopathic, that to the non-doctors, that means we don't know. It means it's caused by itself, that we don't know the cause. So I have this wall chart of foods that a student made of, here are the ones we recommend. All the ones we don't recommend are in this little red box, like the penalty box. Then people will come in and self-diagnose. It's actually brilliant to have, oh, I'm having those nuts again, or something. They're in that penalty box. But I'll say, idiopathic makes me think that it's something in this box, and these are all the carbs. They're all the sugars, the carbs, the gluten, the other highly processed foods. Because even things like Crohn's disease, ulcerative colitis, lupus, rheumatoid. I ask today my patients, what do the doctors say causes it? And either they say it's autoimmune or it's idiopathic, which now I'm thinking it's probably something in that box.
It's the box. And idiopathic means we're idiots, meaning we're closed-minded. And again, no disrespect to any doctor, scientists out there.
We don't know,
We don't know, but I would say we're not open-minded enough. And that was one of the things I feel I was taught. Trust the papers and the scientists and the authorities, and don't question. And Robert Atkins was a key example of that, where he went off the usual path and he found something remarkable, and the general medical community didn't honor him or believe him or weren't open to asking questions. And so that's one of the things I've always loved about this community and what you're doing is we're stepping back and we're saying, that happened. Maybe there's something there, and that box that we're unwilling to open. and take a question. Um, I believe that the microbes in the gut are fermenting the high plant, low animal fat diet. They're infecting the colon, the upper and lower respiratory systems. They, in women, the microbes go out the rectum anus directly into the vagina, and they affect the vagina, the cervix, the uterus, the tubes, and the ovaries.
Yeah. Oh, yeah.
And back to PMS. So, by the way, fermentation also makes alcohol and aldehydes and methanes. And so we have to realize that something is going on. It's subtle. It's almost silent.
Yeah.
That's the part that I'm intrigued by. I have a new book that I just recently picked up. I don't know if you could see that. It's called The Light
Eaters. Yeah.
The Light Eaters by Zoe Schlinger. It's about plants. It's about they've evolved millions of years before us. They have more DNA than us. And they actually are much more intelligent than we know. But the light eaters, they're the ones that they consume light and create life.
Yeah. Well, that's getting pretty deep, pretty metaphysical, doctor. I love it.
But it's science.
Yeah.
When you dig deep and ask the questions, where does heroin, cocaine, marijuana, nicotine, and caffeine come from? Plants.
Yes.
And the one other thing, the number one addictive substance is cane sugar.
Yeah.
It comes from plants.
Yeah. Yeah. There was a classic book called Sugar Blues, which, and much like the opium trade, where people would just get high on opium and not have a life. The Caribbean, the sugar trade. Yeah. Well, may I switch and stay a little bit back to OBGYN? And,
Yes, please.
And not just reproductive health, but so it's said that babies are born in ketosis, and that the mother should be able to have babies in ketosis. And of all the areas, though, in Western medicine where we freak out and doctors freak out, it has to do with babies. And so I've never really had an ortho-trained OBGYN say, oh, yeah, sure, just go keto and have your baby. Although they're a little more open to it now. But so how do you put all this together? Because, I pieced together Dr. Mary Newport, who's a neonatologist, and started talking about the babies being in ketosis, and then moms who actually eat keto have more fat in the breast milk, and the babies might still be in ketosis. And yet in our lifetime, pretty much we all were fed carbs very quickly. It's hard to get outside our own experience. How do you look at nutrition and ketosis and with a pregnant woman, and even then the growing baby, all that from your perspective?
Well, the American College of OBGYN recommends a plant-based diet, lean meat, no red meat, and they recommend red wine. They recommend red wine for pregnant and lactating women.
Really?
100%.
Really?
It's an expert article 3 years ago-ish in the American Journal of OBGYN. And it's the number of women with premature birth and delivery miscarriages, preeclampsia, eclampsia, stroke, and premature morbidity and mortality is on the rise. Same with the babies born is on the rise. And ultimately, that standard healthy diet that we've been sharing, I believe, is the cause of that. If you look at bears, they hibernate and gestate 1 to 4 bears. They lose only adipose tissue. They lose no bone mass nor muscle mass. And I believe we are built for ketosis. I'm
Hmm.
betting hyperemesis in early pregnancy says do not put that food in this body.
Oh, I've wondered too. So to unpack that, there's a serious complication that can happen in women who are pregnant where they don't eat, right? Or they vomit and they're sick, might have to be hospitalized, right? Uh, and you think that might be a response to say no, no more of this junk, huh?
Well, I believe adipose tissue and fat is the only fuel and building block for you and I, and the energy for us, and the building block of a baby. I believe that sugar is not the energy of the cell or the building block. Adipose tissue is. We have to remember adipose tissue contains fatty acids, cholesterol, minerals, vitamins, and every amino acid, simple sugar, and fatty acid required for that baby. That's why we are meant to get fat, get get pregnant, get fat. I mean, progesterone, like again in the post-ovulatory part of the cycle is eat, eat, eat. You're pregnant, you've got stored fat. Now hyperemesis sets in, and just in the first trimester, and usually it's only for a few weeks in most women. And what do we feed them? Crackers. And that's the general treatment. I say don't eat and or butter, or chew the fat, because we're just going in the wrong direction. There's so much inflammation in the gut and the brain and the body. Why it happens to one person and not another, that's still the mystery. But I believe hyperemesis is a protective mechanism to prevent you from eating foods in that first trimester, because the first trimester is the most sensitive time for that embryo, which has to implant, begin to develop the placental bed, which locks into the uterine vascular bed. Now it allows the proper nutrients to be transported. A lot of it is you have this egg, sperm, and now this embryo that's just kind of free, only for about a few days to a week before it begins to implant. And again, the once that HCG begins to rise, the body says, okay, let's allow this implantation to happen in a low toxic environment. Remember, plants provide a lot of sugars, but they also contain goitrogens, which I call tumorgens, and they contain estrogens and progesterones. These are the phytoestrogens, androgens, and progestins that may act as an abortifacient or a birth control like substance. So that's why I think the human body is saying, okay, in our environment, we need to stay away from those things, and stick to the large animals that we hunted for in our initial evolution to become a Homo sapien.
Wow. Well, that makes sense to me. It might seem far afield, but it is sensible. And I'm just trying to think of, pilot studies and is the field ready? Before the pandemic, there was a group that was kind of curious, OBGYN practices, and then I lost track of them. But do you think there would be how should I say, it would be okay, not totally, crazy and malpractice, quote, to study this at least
I think 100%. And we talk about it. We share this with our patients and with our team. We're now working on beginning to bring on some keto and carnivore options for people to begin to at least share their experience of,
Yeah.
well, gee, what did you do and how do we do this? Then that'll line up of our ability to say, hey, we have a few case studies, or we're having more case studies. I think it's time we started lining these up. There was a researcher at the University of Southern California around COVID, or just before that, which was beginning to talk about hyperemesis as a protective mechanism, and how this may have a factor as we're learning more and more about our diets and what are the things. And keto, again, you can be a pure plant eater technically, but as a vegetarian, eggs, butter, cream, and cheese, and then cooking the plants well, adding more fat and eating less frequently even may be something that I think we're talking about it. We're seeing more and more women that are sharing their stories. Now our next level is begin to integrate some of these studies at a level that I think will get the proper IRB approval. And as you've been doing these things and it begins to be shown, I think it's going to happen.
Well, I hope so. And a lot of this is just the fear of studying something new that's not, traditionally done in a highly charged area, like a baby. You just don't want to mess up with a baby. And in a litigious society, that if you do something outside the normal practice, you can get in trouble. Even if you're within the practice and there's a problem with a baby then you're fine. This is not really like rational, but it took a while for the obesity world to acknowledge that low carb and keto was valid, but it took lots of studies and a lot of time. It seems to me like of all the areas where you could study, one of the biggest impact areas would be with babies and pregnant women, don't you?
Well, especially in the infertility world, because I was just in Washington, D.C. at the Health and Human Services to talk about fertility coverage, insurance coverage. But I went there actually to talk about nutrition and ways that we can help more women and men naturally and not say, hey, we need IVF. No, what we want to do is we want to begin to help more people heal naturally. And whether it's paleo, keto, carnivore, or Atkins, there are many things that we can introduce today that'll help people get pregnant. And women, I mean, the most important part is family building. And when you're suffering, I had one gal, she spent all the money she has. She's 38. She makes only 1 or 2 eggs and embryos. She has a very low AMH, which is a poor ovarian function. And she's failed like 7 cycles, has known about the keto carnivore, but never really dug into it. And it was like, well, now I have no money. What do I do? I said, well, look, you're still in a good age group, and don't be distracted by those numbers. Here's something that I've seen 1 to 3 months of changes that suddenly people conceive and get pregnant. I think as more, again, keto, paleo, Atkins, and carnivore all have a place wherever the individual wants to be in all of this. And I think that reproduction has dropped significantly in men and women. And I believe it really is our lifestyle, our diet. Everyone's drinking too much sodas, too much alcohol. Any may be harmful, in my opinion. And not being conscious of what they put in their body. And I think that's something that we're not doing a very good job of in medicine.
So I'm thinking of let's follow the female to puberty.
Yeah.
Does diet affect puberty?
Well, so
Is Pope Catholic?
yeah, is that Pope Catholic? He's right. So are there such thing as foods that affect your thyroid gland? Yes. They're called goitrogenic foods. They're known to inhibit the normal function of the thyroid gland. Fruits, fiber, vegetables, seeds, nuts, basically any and all of them. Now, the brain, the hypothalamic portions of the brain tell the pituitary gland to make certain hormones, LH, FSH, TSH, and others that at the right time tell the testicles to begin to make and mature sperm and make testosterone, and the same thing with the ovaries to begin to mature and release eggs on a regular basis, which takes someone from pre-adolescence to adolescence and puberty, and then suddenly become an adult in your reproduction is hand in hand. more and more boys and girls have problems with these issues, either early onset or late onset, no menstrual periods or heavy menstrual periods, too many. And I believe the diet affects the brain, the hypothalamus, the pituitary gland. We know it affects the thyroid, adrenals, and then the ovaries and the testicles. And the problem is on the rise in this world. And I believe it's back to an illogical, industrially produced, and a marketing diet that isn't good for any and all of us. And so I've seen the difference in especially polycystic ovarian syndrome that's rampant for young girls, and early menstrual periods or late, and then heavy bleeding. And that's all related to this diet. And I believe keto and or carnivore and paleo significantly help those also.
If I could add to your things to say modified Mediterranean. And I that is kind of a joke because my patients will say they're following keto, carnivore, Atkins, and the doctors will, "Ugh," and yet if they say modified Mediterranean, it's smooth through there, but it's still a lot of
Well, I'm Italian, Mediterranean in my family and upbringing and stuff, and I would tell you, I believe that we can take almost any diet, but the Mediterranean diet, for sure, we can tailor it to fit in a way that becomes a keto, paleo, and helps people all the time. One other comment: we are taught as OBGYN doctors not to understand the cause and pathology, but how symptomatically to treat the person. Now, I'm an OBGYN, so I mostly treat young girls, adolescents, and young women, and at all stages. And the birth control pill became our go-to for everyone. And okay, you don't want to get pregnant. Here's a birth control pill. Here's estrogen and progesterone separately. Here's injectable birth controls to help, and an IUD also to sort of help mask the symptoms, make you kind of feel like you're fit in, but never really fixing the cause of the problem.
well, and I've seen the what's it called, the depot shots for contraceptive use cause weight gain. Like
Depo-provera, progesterone. I mean, think about it. Progesterone, right, is the post-ovulatory phase, which says, because think about natural reproduction for the last 50,000 years. I mean, there was no such thing as birth control. You started your menstrual period, you got pregnant. And so ultimately, the number of menstrual periods that people have is completely out of sync to what nature provided. You're either pregnant or breastfeeding through your reproductive age string, right? And so you're right. So post-ovulation, it was eat. Okay.
Yeah.
And so now we add these medications, which is eat, which is growth, in order to get ready for pregnancy. But everything we do is to prevent nature.
Well, that's
my daughter just had a baby 8 months ago. My daughter was a skinny little thing. She gets pregnant. She becomes a fat little thing. She delivers a beautiful baby. Now, 8 months later, she's a skinny little thing and he's a fat little thing, which is what a baby should be.
right. Well, that's wonderful. And congratulations. Yeah. And I don't think I ever heard which is like how true this is, that in our lifetimes, we've suppressed menstrual cycles for purposes of to not be pregnant. And yet the normal paleo or existence would have been, you would have been pregnant. And then that's going to make me think pretty hard about this one. Thank you for that insight. I bet most people just don't think that is so abnormal.
We suppress libido, we suppress everything that's natural to a human animal. And we're punished for it, unfortunately, or fortunately, I don't know whatever you are. But ultimately, our treatment of this particular problem is not thinking about nature at all.
Fascinating. Yeah. So the suppressing libido toggles to the genesis of the cornflake of Battle Creek, Michigan, where they had the sand. People would go to dispel all of worldly carnal desires, and that's always so interesting to introduce someone to that idea that the cornflake was designed to reduce libido. No, it couldn't be. There's a great movie about that, or related in there is The Road to Wellville. I remember there's a young Matthew Broderick who gets taken there to the sanatorium, and Anthony Hopkins is the portraying Kellogg. It's a great film. So now, let's say the woman gets perimenopausal. What's going on there? And could diet matter?
Well, menopause is the cessation of menstrual periods due to the natural depletion of the eggs, because the woman is born with all the eggs she's ever going to make. And then over her menstrual years, they are depleted. And they've either just die off or they ovulate. And so the why that is for women and not for men, we don't know that answer, but it is. And so whether women lived to menopause most of their existence, I don't know that answer. But I can tell you that the phrase of menopause, the condition of menopause, really seems to be a pharmacological and a marketing concept, an idea for symptoms that may be related to inflammation and not your cessation of making estrogen and progesterone in the ovary. And as I've done my research on this, I actually was in a movie on menopause, and I was one of the few that just said, hey, listen, maybe it's not the hormones, maybe it's inflammation, and maybe we should look towards the diet, which seems to be a big reason why so many people have so much inflammation, diabetes, cancer, and all sorts of other things, and premature loss of their eggs and sperm, by the way. So that, and then there's the adrenal dysfunction, because the adrenal glands make some estrogen, by the way, and progesterone, and peripherally there's a little bit. But if you do the research, men may have hot flashes, mood swings, and sleep disorders and osteoporosis, which seem to be all the menopausal symptoms also. And so I do think that we've made a disease and a market space for something that may be related not to the fact that your ovaries ran out of eggs or your estrogen drops, but more generalized and localized inflammatory symptoms that are related to our lifestyle, our diet, as much as anything else.
Does anyone speak about that for a perimenopausal woman to do low carb or inflammatory, low inflammatory foods? I'm just not in that space.
Well, Elizabeth Bright talks about it for sure. I want to say Sally Norton talks a little bit about it, but I think that it's, even in the keto carnivore world, there's a lot of push for women's hormone replacement and things like that. And I'm not pro or against. I'm just here to say, hey, it may be something you want to take, but it's like myself and statins. I have family history of heart disease. I have a little high CAC score. But I'm working more on the inflammatory side of it rather than automatically a drug side of it, supplements and things like that, and diet and other things, where I think more and more people in the keto carnivore space are beginning to talk about it. Sally Norton, I would say, is Elizabeth Bright is one person I certainly know has been a proponent of it. And then there's some others that have written books on this that I think are very helpful.
I've worked with Jackie Eberstein, the nurse that worked with Dr. Atkins for 30 years, for the last 10, 15 years. And she would give talks about reproduction and then menopause and female health. One of the things I remember that stuck out is that, at least in her particular instance, she was down to 10 total grams a day but she chose to do a low carb diet for her life. Was totally skeptical of Dr. Atkins when she started working for him. Kind of a different, interesting sidebar of, did anyone work for you who was skeptical and then now they're following what you do? And that happens all the time. Yeah, but was there anything well, I guess, so you would say hormone replacement for perimenopausal women might be appropriate. So the pendulum is kind of swung back and forth on that one, where in the 80s and 90s, it was like totally against hormone replacement, right, for women. At least this is the
well. I don't really treat menopause anyway, because I'm into helping people get pregnant and have babies. We use hormone replacement because you have to have estrogen and progesterone in order to conceive and deliver a baby, if you're, depending on where you're at in this. But I would, I was very skeptical about all of this when I first went into this and found this dietary idea of disease. And so before I would say anything, I had to research it, and then I had to do it. And I mentioned at the beginning, I couldn't read as a kid, and I was kicked out of school in a gang. I blame all of that, and recognizing that my ADHD, OCD, dyslexia, depression was all related to a cereal-based diet, pasta bread diet, and nobody ever mentioned it. I'd go to the doctor and they say, "Oh, you're fine." I had migraines bad, and so I really look at the same thing regarding menopausal symptoms and all the other things that we're talking about. I've seen the improvements, and I read about it and I talk about it, and we've interviewed people on it. But I think it is remarkable how a simple dietary change, it doesn't even have to be really significant in many cases. And I don't know what your experience on that is, the simplicity of this in so many ways. But, it as an OBGYN and a fertility doctor, we certainly never talked about diet. And I was a minor in nutritional biochemistry at the University of Southern California. We were doing studies on supplements and drugs on rats.
Right. Well, that sounds like internal medicine, which recently a patient of mine, I think it's been out there a while, but he said, of course, that doctor talked about pills. He is an MD. And I said, well, MD, what doctor of medication. I thought that was brilliant. So that OBGYNs are MDs, so they're going to be doctors of medication. But
and I'm a surgeon. What's interesting about so I would operate and remove fibroids or scar tissue or endometriosis. I've seen women shrink their fibroids, endometriosis goes away, and suddenly they conceive and get pregnant. And if you think about all the interventions, we give medications, anti-inflammatory drugs. Well, that heals people. So if we can remove the inflammation, allow nature's natural anti-inflammatory process to come in, many people conceive and deliver a baby. It improves sperm, it improves eggs. And I've seen people which we couldn't get eggs for IVF at all, and they had a very low AMH, very low ovarian reserve, suddenly get pregnant. And I'm like, well, that's not supposed to happen.
Well, tell me about that movie again. You said you're in a movie on menopause.
Reverse TV series. And it was on menopause. They did one on keto and carnivore. They did one on menopause. Charles
Yeah.
Maddox. Charles Maddox did it, and it's not. I don't know if it's quite out yet, but there was one on keto. It's interesting because I met all the keto carnivore people down in Costa Rica at a movie setting, and I was in Animal and in Healing Humanity, and I'm in another movie coming up on carnivore, and it's interesting because I'm primarily a carnivore, but I always say keto or carnivore. And ultimately it falls into the ketogenic milieu environment.
Metabolically, they're very,
Is it the same? And you mentioned children.
yeah.
It's all ketosis.
Yeah.
And you know, and you could do it by fasting. Fasting's a little harder for people, but I do it a lot. But there's so many different ways to do this, and ultimately, the most important thing for all of us is our families.
Well,
And when we're not building families, something's wrong.
that term ketosis, it has a problem because osis means the abnormal condition of, right? So halitosis, so, but that's because it's abnormal compared to those who eat carbohydrates, right? So you do a test, ketosis is abnormal because everyone's eating carbs and they don't have ketones. So, but in the UK, there's a researcher, Isabella Cooper, and her group, who took a bunch of women who are already on a keto diet for 5 years and coined the term euketonemia as the normal condition of ketones in the blood, not ketosis, right? So even Dr. Atkins years ago would say in his books, benign nutritional ketosis. But even then, my teacher, Steve Finney, one of my teachers, I say the nutritional genius of our time, which he hates me saying that, but I think it's true. He still would call it nutritional ketosis. But there's that osis thing. So somehow we got to, and it's going to take 10 years, of course, probably. But for those who don't eat carbs, it's called euketonemia. I'm saying this just because I see you like the precision of different categories and words and all that. So the problem now is if we use the term euketonemia, no one knows what we're talking about.
And I was internal medicine for a year, and I took care of a lot of ketoacidosis patients in the ICU, and then falling into this area. I mean, interesting enough. I mean, acetyl CoA is the entry point to make ATP and H2O and CO2. Well, acetyl CoA is a ketone essentially. And so, it's all from fatty acids pretty much, because I think of insulin as a digestive hormone.
Yeah. Okay.
Because if you don't eat food, I mean, I did a 15-day fast. My insulin was 45 to 60. I felt great. And I'm sorry, my glucose was, and my insulin was less than 1. And so it's such an interesting concept that, it's really a hard area to jump into, but I think that
did you measure your blood ketone levels at that time?
I didn't measure my blood. I did my urine. I mean, it was basically off the track, and I paid for everything else, but I didn't pay for that one. And again, because I'm curious,
Yeah.
I want to know what's really going on in our body, and this is where I go back to the hibernating bears. Fat is the building block and the fuel for our body, period.
And you store energy in fat.
The store energy and the building blocks. And think of an adipocyte like a chylomicron or a VLDL. That's all it is. It's a mastery of your delivery truck. It's the lymphatics are simply delivering everything from that adipocyte in a time of migration, hibernation, gestation, and all the things, because The problem in our world today is we have over access to food.
Yeah. Yeah.
That's the main problem.
Although if it were just no carb food, things would be a lot better, wouldn't it?
No doubt about it. But if you go back to the discovery of cane sugar, and that basically the explorers of the world explored and exploited in order to grow cane sugar. And that's our biggest problem of the world. And then you got rum, you got, we got heroin, cocaine, you got all the other drugs that came along with it. But ultimately, cane sugar is the reason for the exploitation and the enslavement of the world. And we're still living that enslaved life because we're in a drug den, basically. We live in a drug den. It is very difficult to not consume the drugs that we live in. I'm a coffee addict. Well, I was off coffee for 2.5 years. I just went back on it, but it's still a drug.
Yeah. Yeah. Wow. Where do people find you? Where for more information or even for clinical support? This is fantastic.
Well, I enjoy this, and you have an amazing group, by the way. I wanted to recommend one book, The Slow Moon Climbs by Susan Matern. The Slow Moon Climbs. Excellent, excellent book on the evolution of menopause. And she does a great job. drkiltz.com, YouTube, Facebook, Instagram. I've done a TEDx talk. I write books. I share blogs. I watch Dr. Westman. I've read his stuff. And I really, it comes down to we're all sharing an idea. And this is the new medicine of the world, I believe, through social media and through your teachings and empowering everyone that listens and learns in this class. So
back at you for that. Thank you for teaching so much and so well. Let's talk again sometime, huh?
I look forward to Dr. Westman. Thank you, and God bless you.
Thank you. Bye-bye.
Bye all.
If you enjoyed this video, consider joining our YouTube membership for early access and exclusive live Q&As with me. Just click the join button below or support us with a PayPal in the description.